Hi everyone, we're back and the topic for discussion is what is triage? This is an emergency room and typically what happens, triage is sort of a sorting of the patients and using a situation where you prioritize who's going to be first to be assessed. Here we have one patient who's admitted for chest pain. There is another on the right who's having stroke symptoms, and at the very bottom, as you can see, there's a ventilator, and the third patient is in the process of being intubated. And if you've never witnessed it, this patient is in obvious respiratory distress. Tests have been done to diagnose the situation, and the doctor has ordered this patient is put on a ventilator. So you can see from these pictures, this picture, that the emergency room is very busy. Let's talk a little more about triage. The triage nurse has the responsibility of prioritizing which patient is critical and needs immediate attention and which one can wait a little bit longer. Let's take for example, if you have a patient in cardiac arrest, obviously that will be more of a priority than one who has a broken wrist, and the story goes on. And I don't work in every emergency room, so depending on where you work, you need to familiarize yourself with the unit's policies and procedures and find out exactly how. Usually it's something that they orient people to. Not everybody is triage nurse. It's just one nurse is assigned to triage, and usually the department itself works that out with them. So if you have your turn at being a triage nurse, I wish you the best. Now let's take a look at what kind of situations you might expect to come into the emergency room. Well, here's a couple just sitting down under an umbrella outside a cafe, just having a nice lunch, and suddenly the husband says, honey, I feel an awful pressure in my chest. Obviously this is indicative of some kind of a cardiac event, and even though we may not be certain that it is worth attention or not, it is worth actually finding out that everything is above board. So intervention is this patient will be taken to the emergency room. Some of the things would be assessment, vital signs, and lab work, EKGs. Of course, the doctor would evaluate patients. Usually the paramedics are called and this patient is taken to the emergency room. This is Jim, and now he's assessed and treated by paramedics. He's received oxygen, nitroglycerin, aspirin, and morphine. And these are some of the protocols that are set in place by American Heart. And they do have very specific guidelines to follow, what type of EKG rhythm, how to treat it. And usually the staff who handle these patients are very well trained at ACLS to know what to do. So usually if a patient is having chest pain, they ask them to describe the type, whether it's sharp, whether it's dull, whether there's radiation, and they go from there. But my first discussion is stroke symptoms, because that's a biggie nowadays. We have so many patients who are having different type of problems in this area. What sort of symptoms would you expect to find in a stroke patient? Well, here are some of the symptoms. It might be a sudden severe headache, slurred speech, mental confusion, nausea and vomiting, visual disturbances, hearing loss, facial weakness, weakness in an arm or leg, and loss of coordination. And this particular patient she was an opera singer, and she was singing at the opera when suddenly she started displaying some of these symptoms. I don't know if you've ever heard of dysarthria. What it means is weakness of the muscles used for speaking, and this may cause the speech to become slurred. And usually these patients have speech therapy to help with their speech once they have been in the hospital. Usually when patients have been diagnosed with strokes and they have these weaknesses, speech therapy, occupational therapy, and sometimes they may need rehab when they get home so that they can continue this kind of treatment, or they may go to rehab prior to going home. Last but not least, I think that's all. I'm so sorry. That was the end of discussion. Have a nice day.